Hello, everyone. Welcome. Good evening to you all. Um, we are about to start our next open evening that is dedicated to fertility assessments. I'm Dr. Abha Bhat. I'm a consultant gynecologist and fertility specialist at Herts Essex Fertility Center. I'm joined by Jackie McAdams, our senior fertility nurse, and Marna Marks, our marketing manager, who has been working tirelessly to disseminate information about this open evening and who works all the time trying to disseminate information about fertility and fertility treatments to anyone who's trying to conceive. So let's begin. So we'll be starting off with a presentation talking about fertility assessments and end with a virtual tour of our clinic. I would like to apologize that there would be no sound with the video. However, Mana would be happy to post the link to the video so you can watch it online in your own time. We would love to hear what you have to say about this session, and so that we can do it better every time. And please remember that the Q&A session will be going throughout while I'm doing the presentation. And please look out for this Q&A icon somewhere on your screen, which may be on any part of your screen, depending on how it's been set up. So you click on it and post your questions, and we will not leave the session until every single question has been answered. So let's begin. And before I start, just a piece of information that by default, everyone's cameras and microphones have been muted. So the only way you can communicate with us would be through the Q&A chat box. So what is now Herts Essex was founded first as the Essex Fertility Center back in 1989. And we therefore have over 34 years of experience and have helped delivered over 7,000 babies. All the procedures that are done in our clinic are done under one roof, so you wouldn't have to go anywhere for any part of the fertility treatment. It's a state-of-the-art, purpose-built clinic. So before I talk about fertility assessments, let's understand how conception happens. We all know egg and sperm have to meet and somehow pregnancy happens. But not many people realize that the chances of conceiving for natural cycle is at best 20 to 25%, and this is in the youngest and healthiest people. So when pregnancy does happen in a natural cycle, it is indeed a miracle. So on one hand, the egg has to be released from the ovary, and this is typically in the middle of the cycle. And there are currents which are generated from within the fallopian tubes, and this current picks up the egg which has been released from the ovary by usually the same side of fallopian tube, but occasionally can be the other side as well. And when the egg is released, it's not just a bald egg like a hen's egg, say, but it's surrounded by closely associated cells, much like the geometric pattern you see on the right. And these cells play a very important role in ensuring that the egg completes its maturation and is ready to meet with the sperm at the right time. And they also control the access of sperm to the egg. Let's talk about sperm now. Sperm, we all know, is a spindle-like structure with a globular head which contains two things. One, the most important function of the sperm is to carry the genetic material, the DNA, to the egg. So obviously the head contains the DNA, but head is covered by a cap-like structure, which is called as acrosome. And this acrosome contains enzymes which help the sperm negotiate the shell of the egg when it gets to it. The head is after the head comes the midpiece, which is a slightly thicker part of the tail, and it contains energy providing structure called mitochondria. And last is the tail, which of course is the propelling structure which helps the sperm to get from point A to point B. Most of the sperms in any semen sample are not of the ideal shape. And your doctor will tell you, if you ever have a semen analysis, that it's okay to have as many as 96% sperms that are that have an abnormal shape. Right. So once the semen reaches the vagina, what are the hurdles that the sperms have to face before they can get to their target, i.e. the egg? First of all, the biggest hurdle is the vagina, which has a hostile pH, and a lot of sperms aren't able to negotiate this hurdle. And then, of course, there's the physical hurdle of flow back, which prevents many of them from ever getting a chance. Then the sperms, once they go from the vagina upwards, they have to go through the cervix, which is the neck of the womb, and this usually has mucus, which at all other times of the menstrual cycle is thick and viscous, but at the time of ovulation becomes very thin and watery. And so the sperms are filtered across the cervical mucus, and this is designed, we think, to filter out the most physiologically normal sperms, which are motile enough to cross through and go up to the uterus. In the cervix as well as the uterus, the sperms have to contend also with immune response, which gets worse with time. So in a way, it is a race against time. The sperms have to quickly make their way from the vagina through the cervix into the uterus and into, hopefully, the right fallopian tube. Not the side right, but the correct fallopian tube. Of course, here, half the sperms are going to be lost, and only about a small minority, we say less than 1,000 sperms, actually get to where the egg is. Now about the rendezvous. So eggs, in order for sperms to get to the egg and do their job of fertilizing the egg, they have to have one more change that has to happen within the sperm. And this happens once it goes past the cervix. And this process is called capacitation, and it's a sort of an energy boost to the sperm, and it starts moving quite rapidly and in a jerky manner. It also gets ready for the other change that has to happen once it gets in the vicinity of the egg. And that is the acrosome reaction. As I mentioned before, this is important for the egg, for the sperm to negotiate the shell of the egg. It has to bore through the shell and be able to reach the membrane of the egg so that it can fertilize the egg. The egg stays alive for only about 24 hours after it's released at the time of ovulation. And so union of sperm and egg has to happen within that 12 to 24 hours. So let's fast forward to the next stage, which is when egg and sperm have merged. Once the first sperm gets an entry into the egg is able to block off the entry of any further sperms. And the embryo now starts changing, and while it's changing, it's also developing, the number of cells increase, and over the next 4 to 5 days, while the embryo is getting to the stage called as blastocyst, which is when it's ready to implant, it is also simultaneously rolling down the fallopian tube and reaches the uterus just about the time when it's ready to implant. The last, most crucial stage is that of implantation, where the embryo has to interact with the inside cells of the cells of the inside skin of the uterus called endometrium, and be able to negotiate an entry into the skin, burrow within it, and start developing further and become a pregnancy. The next natural question for a couple who is trying to conceive would be, what can I do to make the most of my chances as they are in a natural cycle? Well, apart from having an intercourse every 2 to 3 days, it's important to realize how the system works, which is why I'm explaining all this to you. The last fertile day is the day you ovulate. So if you have regular cycles, you just need to make sure you have regular intercourse till the last possible day, and maybe an extra day when you could possibly ovulate. It's best, I advise my patients to stay away from ovulation kit. It's not very reliable, and it only increases the stress levels among both the woman and the husband, especially the husband. Supplements that you need to be taking include folic acid and vitamin D. Those who have a normal BMI should be taking 400 micrograms per day, and this is available either on its own or as a multivitamin tablet over the counter. In case your BMI is more than 30, you may have to approach your general physician to get a prescription for a higher dose of folic acid, and you need to take folic acid up until 12 weeks of pregnancy, and ideally you should start a month before you actually start trying. It is also advisable to take vitamin D in the dose of at least 1,000 units every day, and best to avoid cod liver oil and vitamin A supplements. For those who are trying to conceive, the best time to seek help would be if you've been trying to conceive and you're less than or equal to 35 years of age, I think after a year of trying, you should seek help. If you're over this age, because fertility starts declining after this point, it may be better to seek advice sooner before the fertility declines further, and therefore your time to pregnancy also increases. In case you have irregular periods or you have had a previous treatment that could potentially impact your fertility, say, for example, a previous cancer treatment, or if you know of conditions which will get in the way of you conceiving naturally, it's better to seek help sooner rather than later. What can be the causes of delay? The first is chance, pure chance. Most couples who start trying think that they'll get pregnant within a few months, and it doesn't really happen, contrary to what films would like you to believe. It takes almost a year for 80 to 85% of couples to get pregnant. Another 7%, 7 to 10% get pregnant in this next year. And those who are left, many of them can still get pregnant, but as the length of time increases, your chances of requiring fertility treatment also increases. So beyond a certain point, I think it's better to seek help sooner rather than later. There can be male factors which can get in the way of conception. There can be female, and in about 1/3 of couples, there can be contributory causes from both man and the woman. I am really passionate about not using the word infertility because infertility has a certain finality to it. It means you cannot conceive, whereas mostly, almost always, there is just a lesser chance of getting pregnant. It's never absolute, and therefore subfertility is a much more apt term to use. So let's talk in detail about what factors can cause delay in conception. These can be male factors, so something to do with the sperm not being enough or being motile enough or having the right shape in the right proportion. At saying that, it is also equally important for me to emphasize that sperm parameters vary all the time. So don't be swayed by one slightly suboptimal sperm parameter, sperm analysis. It may be better to get advice, perhaps see if you can repeat a sperm analysis, and only then further management can be planned. Sexual dysfunction is the other hurdle which can cause delay in conception. In the women, there can be a problem with ovulation, which almost always causes either irregular or infrequent periods. There can be age-related, or because of previous treatments or previous surgery, there can be a low egg reserve. The tubes may be blocked or damaged. There can be endometriosis of varying extent. There can be problems with the uterus, such as fibroids, which are growths arising from the muscle of the uterus, or adenomyosis. Sexual dysfunction can also exist in the woman, causing delay in conception. So who should get fertility assessment? And this is, from this point on, I'm talking to a broader audience rather than just those who are trying to conceive at this point. So anyone who wants to have some confirmation or some reassurance about their fertility. They may be trying to conceive, they may not yet be trying to conceive. They may be single or in a relationship. They may be considering fertility preservation steps, or there may be people who are thinking of having gender reassignment treatment and may want to freeze their gametes before they undergo that treatment. Fertility assessments at Herts and Essex may require maximum of 2 visits over 2 weeks. Let's talk about each of the tests that can be done. Starting with egg reserve. Now, women are born with all the eggs that they can ever have at birth. And from birth onwards, even before puberty, women start losing the stock of eggs. And as the stock of eggs decreases, so does the fertility. Now, most eggs in the ovaries are inactive, and you cannot see them, you can't measure them, but a certain proportion, based on what the stock is, gets active and gets ready and in a position where it can release the egg. The eggs are present in the form of follicles, and when they become active, they are called antral follicles. And if you can see the top 2 images, you can see the ovaries with black bubbles. Each of this black bubble is an antral follicle, which is a woken up follicle with an egg within it. More the number of these follicles, higher it is reflective of a higher or a good ovarian reserve. Similarly, on the right side, you can see a much smaller ovary with just a couple, one small and one slightly bigger size antral follicle. Now, it's not just about the eggs. What matters even more, and what is more crucial, is that as the egg reserve depletes, the percentage of eggs which are normal among that is left also becomes less. So if you can see, this is a normal reserve. This is a woman with a normal reserve. You could expect a lot of these green dots signify eggs which are normal genetically, and the red dots signify eggs which are not normal. So you can see quite a lot of green dots are here. But if you look on the right side, there are only very few green dots. So as the egg reserve decreases, it's not just harder to get eggs out, it's also even more difficult to get a pregnancy using those eggs, because most of them, or an increasing proportion of them, are abnormal. The next fertility assessment is saline infusion sonogram. Now, This uterus is a collapsed cavity where the front and the back wall of the uterus are next to each other. So the cavity is really only a potential space. And if there are any growths arising from the inside skin of the uterus, the endometrium of the uterus, it can quite often be missed. There may sometimes be fibroids, and it's unclear as to whether these fibroids can impact a pregnancy, can impact the success of a IVF treatment, and therefore saline infusion sonogram is recommended so that the cavity can be assessed. For this, we need to put in a thin tube into the uterus and inject saline, whereby the inside cavity is very clearly delineated, and we can pick out if any growths are arising either from the lining of the uterus, or if the fibroids from the uterus are going into the cavity of the uterus and may impact a pregnancy. HyCoSy refers to a special ultrasound-based test to check whether the tubes are open. So again, the same tube as with the saline infusion sonogram is used to inject a special type of gel-like fluid, which appears very bright on scan. And you can see this white line, which is one of the tubes. And you can see very clearly that this tube is open. Semen analysis at our clinic is assessed as per the latest WHO 2010 guidelines, and if combined with a mini consultation would cost £195. The report would include the count, which should be at least 15 million per ml of semen. The motility should be at least 40%. Morphology should be at least 4% normal sperms. MAR test refers to a test which looks for antibodies on the sperm, which can make them clump together and unable to do their function properly. And HbA assay gives us an indication of the percentage of sperms that are mature. We're looking at a percentage higher than 65%. And if this percentage is low, we would recommend that you have PICSI as the method of creating embryos. The blood tests that are done for the woman include full blood count, just to make sure that this is optimized before she gets pregnant. We check for hemoglobin electrophoresis, which is basically to assess the risk of the baby to get sickle or thalassemia disease. If the woman has sickle or thalassemia trait, which means one of the two genes is abnormal, we would check her partner. And as long as one of them are normal, there is no risk of disease for the baby. AMH is an indirect test to check for the egg reserve. We also check for thyroid test, thyroid stimulating hormone or TSH, which needs to be within a normal range for best outcome of pregnancy. It has a crucial role to play in reproductive functions as well. We also check for chlamydia and gonorrhea because while doing a test for checking the tubes or saline infusion sonogram, we don't want to cause an infection to spread. So we always take the initiative to do this test before you have HyCoSy or saline infusion sonogram. The different types of assessments that you can avail of at Herts Essex include couple one-stop assessment, female one-stop assessment, female mini fertility assessments, just a plain simple semen analysis, or just a plain simple HyCoSy only. So let's start with one-stop couple assessment. So this includes you need to register for this assessment. And once that is done, we would book you to come for the first visit, where one of our nurses or HCAs would do your pre-assessment, check your BMI, your blood pressure, take basic history, make sure the questionnaire has been filled. She would also take blood tests for the female partner for all the tests that I mentioned previously. And urine test for chlamydia and gonorrhea. The man would give the semen sample to be tested. Visit 2 is booked as per the woman's menstrual cycle, we need to do HyCoSy or CIS in the first 10 days of your cycle, or um, basically we don't want to disturb a pregnancy. So you need to have avoided unprotected intercourse and come in within the first half of your menstrual cycle, but not on the heavy days of period. And we would do 3D scan to look at the uterus, both your ovaries, check the egg reserve, check the 3D structure of the uterus, make sure the shape of the uterus is normal, do the saline infusion sonogram, HyCoSy, and inform you of all the tests that you've had, including the semen test. And based on all the information that we've now gathered from all the tests, the consultant would discuss the best options for your fertility treatment, or in case you're there to have reassurance, we can answer your questions or point you in the right direction. One-stop female assessment is exactly the same as couple without the semen analysis part. So a single woman who wants to know her fertility can opt for one-stop female assessment. So again, this is done over 2 visits, first with a pre-assessment blood test and urine test, second at the second visit, we would do the scan, the saline infusion sonogram, the HyCoSy, followed by a discussion, and we would be happy to answer any questions. Every visit that you would have would be followed up by a formal letter, which would be sent to you. So you have a record of what your tests were and what the discussion was about your best management options. Mini fertility screen is again a 2-visit assessment. In the first visit, you would have pre-assessment followed by blood test, but these blood tests are not going to be extensive and only AMH is done. And in the second visit, we would do a 3D scan to look at the shape and the structure of the uterus, as well as the egg reserve, the antral follicle count, followed by a discussion with the consultant. Many women are waiting for a HyCoSy on the NHS, and we are aware of the long waiting list, 9-10 months long waiting list, and you can avail of this test at Herts Essex, where we would not just do HyCoSy, but do a 3D scan followed by a saline infusion sonogram and the HyCoSy, of course, and give you a full report of the test. HyCoSy test, we would not be doing any blood test or urine test prior to the appointment. Followed by any or all of these appointments, one of our, me or one of my colleagues would discuss your fertility status, explain what may be the relevant ways by which you can optimize your fertility, what supplements you need to take, answer any questions that you may have, what are your options for fertility treatment in case you're thinking of freezing your eggs. We can point you in the right direction for that as well. And one important thing, again, is many women, many couples are waiting for their NHS-funded IVF referral. And before they do that, they need an assessment for which itself there can be almost as long as a year-long waiting list. And we would be happy to do this assessment for you, follow it up with a formal letter, which you can then go to your GP with, and thereby shorten your waiting time to be referred for NHS-funded IVF treatment. This is just a table which compares all the different assessments, because I know that most of our patients find it extremely confusing whether they should go for couple one-stop or mini fertility. What is the difference? And therefore, this is the chart. I've just explained all this. Couple one-stop, we do absolutely everything. This is done over 2 visits. Female one-stop, we do all the tests except for the semen analysis. Female mini fertility, we don't do extensive blood tests, and we don't check the tubes or the uterus. Just a basic 3D scan to look at the antral follicle count and an AMH. HyCoSy, of course, is just a very focus scan to look at the cavity of the uterus and to check whether your tubes are open. Why us? We have more than 34 years experience. We have a laboratory service which works 7 days a week. We boast of an electronic witnessing system through which we can proudly claim to avoid human error. All the embryos, sperm samples, eggs, everything is tagged, and so the AI helps us and prevents us from making any errors. Everything is checked and cross-checked at every stage. And therefore your gametes, your eggs, embryos, sperm are safe with us. We have a lot of rich experience behind us, and we are, I'm proud to say, we're renowned to provide very good emotional support throughout the treatment, and giving you the right vibes, and helping you make this journey less painful and more positive. Please do complete the short survey to let us know how we can improve this event. I hope you've been asking a lot of questions, and Jackie has been busy answering those. A survey link will be sent in the question and answer chat, and also by SMS tomorrow. Please feel free to connect with us through our social media platforms. And you can book an appointment for fertility assessments by contacting one of our friendly team from Monday to Friday. You can either call us on 01992 78 50 60 from 8 a.m. till 4 o'clock in the afternoon. And you can also email us, and we have no waiting list. And depending on your cycles, we should be able to offer you an appointment for fertility assessment in as short a period as 1 week. I'm going to start the virtual tour of our clinic. And just to remind you, we do not have sound, and I'm sorry, that's more to do with the Microsoft team.